Hi, my name's Paul Wise, and I'm in your speech class, and I guess somebody's got to be first, so it might as well be me. Our assignment this week was to introduce ourselves and an item that is important to us. In keeping with last week's virtual brown bag, I know most of you read probably all the threads. One thing that I listed in my virtual brown bag that's important to me is my stethoscope. My stethoscope is very important to me. It enables me to do my job. Imagine you have open heart surgery, and the first face you see after you wake up is this one. I must say that I'm a pretty large individual. I'm 6'5". I weigh 270 pounds, and probably not the first person you want to see post-operatively. What I use my stethoscope for prior to you waking up, when you first get there, is I listen to your breath sounds. I want to make sure that you're passing air through your lungs on both sides, left and right. I also listen to all four chambers of your heart. I listen to your valves open and close. I listen to your stomach and your belly sounds. Everyone knows what that sounds like when you're hungry. Normally I don't hear that post-operatively. But you do have a tube down in your mouth or in your nose that goes down into your stomach and empties your stomach contents, and I won't be gross. But I want to make sure that that tube's in the right place. When you wake up, again, the first face you see is mine, looking right in your face. You have a breathing tube in your throat, and you're scared to death. That breathing tube in your throat, while it is breathing for you, it sometimes feels like you're drowning. That's what I've been told. So that makes a patient's anxiety go very high. What I try to do in that instance is I try to talk to them, calm them down, tell them they have to work with me in order to get that breathing tube out. And when the breathing tube comes out, usually the nurse, me, gets very happy, because that's the first step in the healing process post-operatively. I know there's some nurses, there's a lot of other nurses in our class, and some have mentioned that they don't use their stethoscope because they work with isolation patients, or they work in mental health. I couldn't do my job without my stethoscope. I couldn't do my job adequately. I do have to say also that I'm a late in life nurse. It's a second career for me. I spent a lot of years in industrial management, and when all the mills closed, I decided to re-educate myself. Becoming a nurse was the best decision I ever made. I suppose that's it for my introduction speech. I hope you have a little better understanding of what nurses use their stethoscopes for. I know whenever you walk through a hospital floor, an intensive care unit, you see a bunch of nurses walking around, and we all have our stethoscopes hanging around our neck. And while most lay people do understand that it's to listen to the heart, we do listen to pretty much every bodily function with it. It's a vital, important part of what makes me do my job, and again, I couldn't do my job without it. As I said when I started, somebody had to be first. I guess it was me. Any questions regarding my stethoscope or what I do, please feel free to address them on the discussion board. Thanks.